Welcome to class, students. Today we'll be looking at a very important topic titled Health Equity. Health equity represents the principle that everyone deserves a fair opportunity to achieve optimal health and well-being, requiring the elimination of systematic or systemic barriers. So it ensures that, or it implies or represents that everyone has fair opportunity to achieve optimal health or have access to health quality health facility. Health equity represents when all individuals can reach their full health potential regardless of social, economic, demographic or geographic circumstances. It recognizes health as a fundamental human right and requires addressing obstacles like poverty and discrimination. Determinants of health equity: structural factors like political, legal and economic systems. We have social conditions like living and working environment. We have institutional processes, how power and resources are distributed. Discrimination based on characteristics like gender, age, race, ethnicity or disability often becomes embedded in institutional practice, leading to underrepresentation and inadequate service provision for certain groups. We want to look at the three principles of advancing health equity. We have principle one: understand and adapt to your audience. Principle two: present health equity as a collective concern. Principle three: demonstrate that health equity is attainable. Core health equity guidelines. Principle one: understand and adapt to your audience. The concepts involve recognize and respond to your audience existing knowledge, perspective and comfort level with health equity topics. Importance involve understanding how your audience perceive concepts like equity, equality, justice and social determinants of health. Enables you to craft messages that resonate rather than create resistance. Practical application of principle one involve progress gradually with your audience using language that emphasizes choice and agency. Guide them to discover concepts as if they were their own insights. Establish appropriate content while explaining the mechanisms behind health disparities before identifying affected population. Facilitate perspective transformation by helping your audience. Okay, practical application involve progress gradually with your audience using language that emphasizes choice and agency. Guide them to discover concepts as if they were their own insights. Establish appropriate content by explaining the mechanism behind the health disparities before they identify affected populations. Facilitate perspective transformation by helping your audience develop new viewpoints that can positively influence their actions and beliefs. Principle two: present health equity as a collective concern. Core concepts: emphasize shared values, interconnectedness, and mutual benefits. Help audience recognize how inequalities or inequities affect everyone, avoiding divisive us versus them perspectives. Importance: negative framing that simply highlight disparities often prove ineffective and may generate fear or resistance. Instead focus on systemic factors like transportation barriers to destigmatize disparities and demonstrate how addressing inequalities benefits society broadly. Practical application of principle 2, that is present health equity as a collective concern, utilize positive outcome messaging that emphasizes making optimal health accessible to all populations. Clarify that health equity advancement doesn't require sacrificing resources for one group to benefit another. Share examples like the curb cut effect, sidewalk ramps designed for wheelchair users that benefit many others, to illustrate how equity-focused solutions often provide widespread advantage. Principle 3 is demonstrate that health equity is attainable. Core concept: break down health equity into manageable components with multi-level solutions. Provide concrete examples of how individuals, communities, healthcare system and government can contribute to progress. Importance: messages that exclusively attribute disparities to structural factors might inadvertently diminish individual sense of agency and motivation to participate in change efforts. Practical solution of principle 3, that is demonstrate that health equity is attainable. Use action oriented language when discussing inequity producing condition. Always include or including pathways for addressing these disparities. Avoid language reinforcing fatalistic viewpoints that suggest change is impossible. Instead, help people identify some determinants as root causes, while emphasizing that meaningful policy and structural intervention are achievable. Advancing health equity in practice: for health and healthcare professionals, incorporate new vital measurements in patient assessment. Actively support low income and non-English speaking patients in accessing necessary care. Implement safeguard against po ten tial bias in medical treatment. Ensure appropriate representation of elderly people, women and racial/ethnic minorities in clinical research. Implementation strategies: use action oriented language. Demonstrate pathways for addressing disparities at multiple levels. Avoid fatalistic framing that suggests unchangeable outcomes. Connect social conditions to health disparities while highlighting potential interventions. By applying these principles, communicators can more effectively advance understanding of and commitment to health equity across diverse audience. So by applying this principle, you'll be able to communicate effectively and also help commitment to health equity, commitment or promotion of health equity across diverse audiences. So examples of promoting health equity are healthcare accessibility enhancement, social determinant intervention, community-centered programming, structural reform advocacy, mental wellness access expansion, research representation improvement, health knowledge empowerment, housing security promotion. So we have healthcare accessibility enhancement, that's enhancing healthcare accessibility to everyone. Social determinant intervention, community centered program, doing program that has community in mind, that the focus is on community improvement. State of community development, structural reform advocacy, mental wellness access expansion, research representation improvement. I also have health knowledge empowerment, housing security promotion. The essence of health equity, as its core, health equity means creating condition where every individual can realize their full health potential, where every individual can have access to healthcare facility Unfortunately, numerous social and environmental factors restrict people's ability to maintain good health practices and access appropriate care, creating health inequalities. Common barriers to health equity are racial and ethnic discrimination, limited educational opportunities, economic and wealth disparities, inadequate or unstable housing conditions, and unsafe living. So common barriers as said, unsafe environment, inadequate housing, income and wealth gaps, lack of access to quality education, racial and ethnic discrimination. So health disparity refers to a significant variation that impacts an individual ability to achieve health outcomes. So this can be as a result of various factors such as gender identity, education and attainment, income level, disability status, racial and ethnic background, geographical location, and sexual orientation. This disparity, typically beyond individual country, create unequal health opportunities and lead to health inequalities. They represent a starting point when addressing healthcare access challenges. So differences in between health equity and health equality. In terms of universal standard, health equality provides identical opportunities to everyone regardless of circumstance. This approach applies uniform solution across population. For example, a community health center offering identical free or low cost checkups to all community members without consideration of individual circumstance. While health equity, that is individual approaches, health equity tailors opportunities according to specific needs, recognizing that different individuals require different resources to achieve similar health outcomes. The same health centers implementing a sliding fee scale where services are free for those unable to pay while others contribute according to their financial capacity. In essence, health equality distributes identical resources to everyone, while health equity distributes resources proportionately based on need to help everyone reach comparable health care. So key strategies for promoting healthcare, we have examine implicit biases, practice inclusive engagement by respectively involving affected community in decision making, implement continuous evaluation of equity initiative, mobilize community assets and talent through volunteer programs, mentorship and skill sharing that addresses social determinants of health, work collaboratively across sectors, dismantle systematic barriers to healthcare access and quality. Thank you for listening.